Case number 11. A 45-year-old male came with cervical supraclavicular lymphadenopathy. Cervical lymph node biopsy was taken. The lymph node demonstrates complete architectural effacement by a nodular pattern and thick, broad fibrous bands that surround the nodules. The lymph node demonstrates complete architectural effacement by a nodular pattern and thick, broad fibrous bands. The lymph node shows a thickened capsule. This image demonstrates that nodules contain scattered large mononucleated, binucleated, multinucleated Hodgkin Reed-Steinberg RS cells. A reactive heterogeneous inflammatory cell background can be seen, including small lymphocytes, eosinophils, histiocytes, neutrophils, and plasma cells. Reed-Steinberg RS cells are large binucleated or multinucleated cells with a distinct large eosinophilic inclusion like macronucleoli and abundant pale amphiphilic cytoplasm, mimicking an owl's eyes appearance. Hodgkin cells, mononuclear RS cell, large, ovoid to round with vesicular nucleus and prominent nucleolus. Scattered large multilobated lacunar cells. RS cells sit in a lacunae-like space, which is an artifact of inadequate fixation, usually with formalin. Mummified cell variant, degenerated or apoptotic cell with dark cytoplasm and condensed hyperchromatic nucleus. This micrograph shows scattered lacunar cells, including mononuclear lacunar cells and large multilobated lacunar cells. A reactive heterogeneous inflammatory cell background host response can be seen, including small lymphocytes, eosinophils, histiocytes, and plasma cells. These micrographs demonstrate RS cells with a reactive heterogeneous inflammatory cell background, poorly formed granuloma, and multinucleated histiocytic giant cells. This micrograph demonstrates a thickened capsule, a reactive heterogeneous inflammatory cell background, hyalinized fibrous bands with amyloid-like material, and poorly formed granuloma and multinucleated histiocytic giant cells. Immunohistochemistry. The neoplastic RS cells are strongly positive for CD30 and CD15. Immunohistochemistry for CD30 and CD15 highlights frequent RS cells. Reactive lymphocytes in the background demonstrate positivity for CD3 and CD20. Okay, what is the diagnosis? It is nodular sclerosis, Hodgkin lymphoma. Okay, let's talk about nodular sclerosis, Hodgkin lymphoma. General background. Nodular sclerosis Hodgkin lymphoma is the most common form of Hodgkin lymphomas, representing approximately 70% of all cases. It is the most common type of Hodgkin lymphomas in those younger than 50 years old, with a peak age range between 15 and 35 years old. Nodular sclerotic Hodgkin lymphoma has a marked predilection for the cervical, supraclavicular, mediastinal lymph nodes, and thymus. Histologically, nodular sclerosis Hodgkin lymphoma is characterized by a triad of findings: a nodular pattern, broad bands of fibrosis that surround nodules, and lacunar cells. According to the WHO classification definition of nodular sclerosis Hodgkin lymphoma, at least one nodule must be surrounded by fibrous bands. Approximately 90% of Hodgkin lymphoma patients can be cured with appropriate therapy, and all histologic types are responsive to standard therapy. The relative survival rate at 5 years for nodular sclerosis Hodgkin lymphoma is 86%. The prognosis is similar to other types of classical Hodgkin lymphomas when modern chemotherapy based on adriamycin, bleomycin, vinblastine, and dacarbazine (ABVD) is used. Thank you.